Mental health and disorders. OCD and ADHD. OCD, obsessive-compulsive disorder, is characterized by the constant presence of manias, repetitive behaviors, and recurring and persistent thoughts that cause great suffering and discomfort in the child's life. OCD in childhood appears gradually reaching the age range of 6 to 11 years old, and may be of environmental origin or through daily contact with a relative who manifests the disorder, or even due to inherent personality traits of the child himself, who is extremely perfectionist, anxious, or who craves constant approval from others. In the school environment, OCD has a strong impact on learning, such as a decline in academic performance, difficulties with attention and concentration, and, in more extreme cases, school dropout. In the child's daily contact with peers, it is common for them to camouflage the symptoms of the disorder, for fear of being ridiculed or overlooked by the group. Parents and teachers can also be aware of dermatological problems in children's hands. In addition to the appearance of skin lesions or abrasions due to constant scratching, rubbing, scraping, or hurting of the area, there is also a range of behaviors displayed by the young person or child during the school routine that can be a warning sign for educators, education professionals. Excessive organization of personal belongings, such as notebooks, lockers, filing cabinets, arrangement of pencils, erasers, and pens on the table, always positioning the backpack in the same way. Exaggerated personal hygiene and self-care, constant trips to the bathroom, frequent hand sanitization that can result in pain, swelling, rashes, or bleeding in the area, presence of tears, marks, or holes in the notebook due to excessive use of the eraser on the paper, constant reading of the same phrase, word, or sentence in order to get the impression that it has been memorized well. Excessive slowness in the same activity as a result of a perfectionist attitude, frequent checking of personal belongings on the table or under the desk at the end of class, in an attempt to make sure that nothing has been forgotten, refusing to touch classmates' belongings, such as notebooks, pencils, erasers, pens, or even feeling bad when someone handles one of their belongings, presenting repetitive patterned behaviors, such as walking without stepping on stripes, colored tiles, counting tiles or cars passing by on the street, intermittently repeating numbers or syllables that come to mind, opening doors, cabinets, windows, drawers, and other compartments at school without using your fingers, not eating, sleeping, or socializing for weeks in order to memorize all the school material for a future event that has not yet happened, and there is no certainty that it will occur. OCD is a mental disorder that can be treated. If teachers observe repetitive behaviors displayed by the child at school, the educator should talk to the parents or guardians of this student so that there is specialized professional monitoring in order to treat the symptoms, with the intention of generating a better quality of life for the child. Treatment consists of psychotherapeutic intervention through cognitive behavioral therapy, which aims to help the patient modify learned behaviors in order to transform them into adjusted responses in their daily lives and in their attitudes. In some cases, medication is necessary. Therefore, the child's family members should take him or her to a psychiatrist so that he can prescribe the appropriate medication according to your clinical condition. ADHD, Attention Deficit Hyperactivity Disorder, commonly known by the acronym ADHD, can be defined as a disorder characterized by inattention, impulsivity, and restlessness. Causes of ADHD. The causes of ADHD are varied and seem to result from a combination of biological, environmental, social, and genetic factors. According to the Brazilian Association of Attention Deficit, studies have already linked ADHD to hereditary causes, substances ingested during pregnancy, fetal distress, exposure to lead, among other factors. ADHD symptoms. According to the Brazilian Association of Attention Deficit, 2 types of symptoms appear in people with ADHD. 1. Inattention. 2. Hyperactivity. In childhood, the inattention characteristic of ADHD causes a series of difficulties. When it comes to assimilating school content, the child has difficulty paying attention to details, following instructions, completing activities, whether daily or school-related, and engaging in activities that require great mental effort. In addition, the individual often forgets daily activities, changes the subject, gets distracted during conversations, switches tasks, and changes focus with other stimuli. In addition, children with ADHD have great difficulty staying still, are very restless, and have behavioral problems, such as difficulty following rules. Regarding symptoms of hyperactivity, the child fidgets with his or her feet and hands a lot, gets up from desks in class frequently, moves around excessively at night, runs in situations where this is not indicated or permitted, and is unable to engage in quiet activities. The symptom of impulsivity can also be easily observed in children. Patients with ADHD generally respond without thinking and have difficulty waiting their turn in activities. Diagnosis of ADHD. The correct diagnosis of ADHD can only be made by a properly qualified professional. Since many of these symptoms can be associated with other disorders, it is worth noting that there are no specific tests, such as MRI or electroencephalogram, to detect the disorder, and the diagnosis is entirely clinical. To correctly identify ADHD, the professional, who may be, for example, a psychiatrist, neurologist, or pediatrician, will analyze the patient's symptoms, their duration, frequency, intensity, and persistence. The professional will also evaluate the damage caused by these symptoms to the patient's life. Only after these analyses can the diagnosis be made. Types of ADHD. ADHD can be divided into 3 basic types, based on the symptoms presented by the individual. These are types of ADHD. ADHD with predominance of inattention symptoms, ADHD with predominance of hyperactivity, impulsivity symptoms. Combined ADHD. ADHD problems also appear in adults. It is estimated that approximately 60% of children and adolescents who had this disorder in childhood continue to have some symptoms in adulthood. Individuals with this problem are inattentive to their normal activities, such as work, for example, and have difficulty determining priorities for what needs to be done. They often interrupt their work to start other work, without being able to finish what they had already started, often feeling overwhelmed. The restlessness in these patients tends to be milder than that observed in childhood. When observing children and adolescents with ADHD, there is a higher incidence of the combined type. In females, ADHD with a predominance of inattention symptoms appears more frequently, this type being characterized by a greater need for help with school activities. ADHD with a predominance of hyperactivity or impulsivity symptoms, because it makes the individual more aggressive and has a greater amount of conduct disorder, ends up causing greater rejection of this individual by peers. It is worth noting at this point that adequate treatment is essential not only to improve the individual's symptoms, but also their relationships with other people. Treatment for ADHD. Treatment for ADHD is done with the help of medication and therapy. It is advisable to seek medical specialist care to indicate the most appropriate medication after examinations. Among the therapies, the so-called cognitive behavioral therapy stands out, which is a form of psychotherapy highly recommended for people with the disorder discussed here. When the patient has speech disorders, help from a speech therapist may also be recommended. It is worth noting that school-age ADHD patients deserve special attention in order to obtain better results. Therefore, it is essential that teachers use appropriate techniques to facilitate the learning of this individual, always remembering to never propose activities that are too long and to explain, step by step, what is intended in an activity. In this case, it is essential that school and parents work together. It is also important to say that the lack of treatment can have serious consequences for an individual's life. According to the Brazilian Association of Attention Deficit Disorder, there are numerous studies showing that ADHD is associated with academic failure, school dropout, traffic accidents, drug and alcohol use, divorce, among other negative situations in adult life. Therefore, when you notice the symptoms discussed here, it is essential to seek specialized help. Subscribe to the channel and leave your thumbs up to receive more posts.